I'm Dr. Bojana Yankovic.
And I'm Dr. Teresa Dean.
And we're going to talk about constipation, what you can do about it, what are some of the red flags, what you should and shouldn't be eating. We know that different people have different bowel habits, and so what may be normal for you may not be normal to someone else. So in terms of the definition of constipation, we're really talking about bowel habits that are different from the ones that you've had most of your life, and having longer intervals between bowel movements.
And then there's the actual strain part that most people associate with, and that's usually like the secondary sign. If we pay attention a little bit more to our frequency and the changes in bowel habits, sometimes we can head things off before they get to the point where people are feeling more pain and strain involved with their constipation.
Some of the things that I recommend to my patients right off the bat is I ask them about their hydration levels, and are they drinking enough water? Are they hydrating themselves? Are they having too much caffeine and maybe dehydrating themselves as a result? So definitely increasing your water intake, making sure that you're taking enough with respect to how much you're losing, let's say through exercise or sweating, is really, really important.
The other thing to think about is your diet. We usually think about, vegetables and fruit, and in general that's a pretty good answer.
Exactly.
That's something, but we also want to think about which vegetables and fruit.
Yes.
One of the culprits is here. It's a banana. It's one of the few that actually causes constipation. And when you think about your children too, we do a lot of bananas in the diet. Kids run around, they're eating a lot of that. So it's one of the few things kind of looking at their diet too, to pay attention to for what's going on with their bowels.
And then eating some of the things like rice, bread, pasta, pastries. We really have to make sure that we eat those minimally or in moderation, because that's certainly something that can promote constipation. And then another couple of things in terms of lifestyle is how much are you moving, right? So if we're used to sitting down at a desk for 12 hours a day, let's say at work or in the car, that can certainly also promote it, because again, we're not allowing our body to move freely. We're not allowing the digestive system to work as it is supposed to. So definitely incorporating as much movement as you can, whether it means taking breaks, taking stairs at work, incorporating an exercise schedule into your daily routine is extremely important.
Yeah.
Sometimes people delay going to the bathroom because they might be at work or in a specific situation where it's a little bit difficult to go and take that time, but it's so important to really go when you need to go.
Yeah.
Otherwise, you're kind of sending a signal to your body that, okay, this is not important, I'm not dealing with it, and then that urge may not be there when you need it. What are some of the supplements that you usually start off with?
I try to go as natural as possible, so really sticking with like a psyllium, if they can take the psyllium, just, psyllium is in Metamucil, although with Metamucil it comes with some sugar and some flavor and everything else. But if it's the only way you're going to take it, then it's still not a bad option.
Might be worthwhile. Yes, for a short period of time, of course. Yes.
Yeah. And then, there are other mix-ins to drinks, like the Miralax, and a lot of GI does recommend Miralax. I do find some people find it might be a little bloating, so just pay attention to your body. If you feel that way, maybe switching up to something else. And then there's easier things. A lot of people like to take things in a capsule, so they don't have to mix it in and nothing tastes different.
The other options that you may try or may have tried are Colace, which is a stool softener, and Senna as well, which is a stimulant, so it will promote that GI activity and can be quite potent actually. So definitely speak to your doctor if this is something you're thinking about trying and whether it's something that would be appropriate to try in your particular case. We also wanted to review some of the red flags to be aware of. Constipation can be caused by many, many different things, and certainly if your bowel habits are starting to become abnormal compared to what your normal is, definitely see your doctor. But some of the other symptoms that you may have that would warrant a physician consultation would be blood and stool, unexplained weight loss, stomach pain, nausea, and vomiting. So hopefully this has been helpful. Please let us know if you have any further questions that would be suitable topics. We're happy to address that. But also, if you do have problems with constipation, do see your doctor. It's really important. Thank you.
Thank you.